especially with this population who largely feels completely out of control about their entire life. When I can give them the tools and the assistance to be able to take one piece back, I think that's probably the most meaningful thing.
We have a really strong interdisciplinary team at the health department, which is so rewarding and exciting to work with. We have a physician who values our services, who is always asking, ways that we can help her and help the patients as well.
Dr. Pham likes to bring all of her patients in that have diabetes on Monday, and we hold the diabetes clinic on Monday. When she finishes with the patient, or if we're going to get to the patient first, then we just walk her down to the next exam room, and we just tag team the patients that way. That way we deal with everything in one visit. If he has somebody that has, more complicated stuff and he thinks that they need more time, he just says, make an appointment at the diabetes clinic, and he sends them up to us. All right, so he loves us because we save him time on the floor, as well as, when we're working with him on the floor, we're like giving dosing recommendations and different things like that. I talked to her a lot about being in control of the diabetes rather than the diabetes controlling her. And she came back the next week. She said her kids started complaining because every time she picked something up, she was reading the label. And I'm just like, success. That's the first success she's seen, where she saw, I can be proactive and control this. We had one of our patients who came in and would go off with the rest of the guys, and they would, go hit Burger King, and his blood sugars were consistently running high. Because he went from a Whopper to a Whopper Jr., and he got sweet tea instead of a Coke. He thought he had done something great. All the menus now for these kinds of things are online, and we pulled it up and we said, well, okay, we flipped around, we showed him, and I said, so you had 10 carbohydrates in that meal. You telling me I had all the carbohydrates for my entire day, that one meal? And we said, yeah. And he went, okay. Came back the next time, he doesn't eat Burger King anymore.
Truthfully, I think pharmacists are exceedingly effective in helping patients change behaviors, and particularly in a very complex situation such as diabetes. I also find the compassion and the innovation that pharmacists bring to the conditions and to the challenges is refreshing, and they are able to work very effectively with other members of the team, as well as the patient and his or her family. And because of those excellent communication skills, because of being able to work outside of the silo, they help us all work together toward that one goal, which is that healthier patient and that healthier community.